Hi, I'm Dan Farrell, and this is my son Jay. Quiet mouth, Jay. We're on camera here, television. We've lived in coastal Orange County for the last 30 years, and I've been Jay's care provider for the last 40. And most of that 40 years has been a constant struggle to stay straight with insurance companies and have coverage for conditions that don't affect most people. When Jay was born, the day before I was promoted to New York City, I shifted insurance policies from something that would have given me $25 a day for a hospital room in New York City to something that was capable of sustaining people that worked in the executive offices. But still, we had to have the insurance commissioners in 3 states qualify my transfers, particularly when I exchanged companies. You be quiet now, Jay. So all of the benefits that we were able to accrue basically were things that happened after we settled in Orange County 30 years ago. The climate, the people, the compassion, the outlook by the citizens and the people in the state toward developmentally disabled young people and adults make Jay one of the stars of the Orange County special education system. We went through it soup to nuts. So we're delighted that we have a better life than a lot of other people in other parts of the world that have to struggle with insurance constantly. His mother is still working, and I would love to see her retire, but we need the insurance. So we're like just about everybody else I know, and anxious to have some sort of remedial. Okay, Jay.
Hi, I'm Aaron Buchwald, and I haven't had any healthcare nightmares, but I do think that it's just absurd that in advanced countries such as ours that people are denied healthcare. It's unforgivable. It's morally wrong. Somehow people bought into this idea. Maybe it started in the 70s that corporations should be allowed to make profits at the expense of people. Insurance companies, drug companies, and companies can move jobs offshores. I think that mentality just needs to be broken. Otherwise, we're not going to be able to take on the insurance industry and get this health care for everybody. So it's high time we do it. It's inexcusable, and let's get affordable health care, national health care for everyone. That's all.
My name's Larry Agron. I'm a member of the Irvine City Council. I am also married to Phyllis Agron. We've been married for over 40 years, and Phyllis is a pediatrician, a long-time pediatrician, having been educated here at UC Irvine, right here in Southern California. And we both have a lot of experience with the healthcare system. Phyllis directly, of course. I as a family member, and also as a long-time advocate for healthcare reform. I was legal counsel with the State Senate Health and Welfare Committee in the early 1970s up in Sacramento. And I worked for State Senator Tony Bielenson. He in turn worked very closely with then State Senator George Moscone, who went on to be mayor of San Francisco. They worked very closely on healthcare reform for the state of California. This was in 1972, 73, and 74, and I was privileged to be a part of that effort. Sad to say, of course, we were not able to achieve anything but the most incremental reforms in California in those days, and of course our efforts nationally up until now have met with strong adversaries, the insurance companies, the AMA and others over the years, taking a very retrograde position on all of these things. But now I think for the first time, having witnessed and having been a part of trying to ameliorate the tens of millions of people who go without health care day in and day out. Certainly they go without insurance, or they face bankruptcy, personal ruin. I think after decades of this, the American people are finally ready. And we take President Obama at his word that he is committed to getting health care reform done and getting it done this year. And I think it behooves all of us as American citizens to get engaged, to get involved, to see to it that we finally make it over the hurdle and have a healthcare system worthy of the American people, where no one is deprived of essential health care and where health care is affordable to all.
Okay, my name's Dr. Louette Forrest, and I'm a veterinarian, and I work at UC Irvine. And you might wonder why a veterinarian's here, and I wish I wasn't, but here I am. I'm one of the walking wounded because of lack of public services and healthcare for people that need help. And I think because I've always been an advocate for those who can't speak for themselves, that it became natural once my family tragedy happened in 1998. My brother-in-law is schizophrenic, and I'm from Detroit, and he was in a psychiatric hospital, and they released him when he was laying in bed in the fetal position, and 10 days later he stabbed his father to death on the sidewalk of Detroit. And my father-in-law laid on the sidewalk for 45 minutes before help arrived. So definitely better public service to me is not a matter of a nice idea. To me it's imperative, and I don't feel that I can sit here while people suffer. I work in research, in lab animal research, and we have federal laws under the Animal Welfare Act, and that basically says we have to take care of animals. So as a veterinarian, if I have sick animals and I turn them out in the street, it would be in the register on the front page. But they turned my brother-in-law out on the street, and nobody made the front page, even because there's so much problems in Detroit. So when the idea that I worked for the Democratic Party, and I worked hard, I precinct walked, and I wanted to make this country better. And President Obama promised change in healthcare reform, and I'm here to tell President Obama that I'm not going to be quiet until we get single-payer healthcare, because we're a better country than this, and people shouldn't have to lose healthcare because they're unemployed, because they're sick. That's when they need healthcare. And to make profit on the backs of sick people, and for people to go bankrupt because they've had medical costs they can't take care of themselves, is endangering our whole middle class. My brother and sister don't have insurance at this moment, and I just always am praying that they don't need to go into the hospital because they'll lose their home. So I'm not here for me, I'm here for my family.